I believe that it's important to promote awareness for rare diseases in general, and specifically for the rare disease that is very personal to me, given that my daughter has a rare disease by the name of epidermolysis bullosa. The acronym in which most people know about it is called EB, but it's a very rare disease. It impacts about 1 out of 20,000 live births in the United States, which is about 200 people born each year. And there's estimated about 25,000 individuals living in the United States with this very rare condition. It's a connective tissue disorder, and how it manifests on a daily basis is her skin is characterized as like a butterfly skin. It's very fragile, such that slight friction or any sort of hard, typical movement on our skin has a really negative impact in the form of open blisters, wounds, and chronic pain on a daily basis. Our daughter was born June 21st, 2007, and immediately upon her arrival, we had the great fortune of having a doctor in the NICU that had seen this case about 3 times over his 35-year career. And within a couple hours, he was almost certain that it was a diagnosis of epidermolysis bullosa. It took about 30 days, almost a little bit over a month, for us to receive a formal diagnosis from a skin biopsy that was taken when our daughter, named Ella, was just 3 days old. We manage it, basically there's no cure at this moment, and there's no major treatment. It's typically palliative daily care, which means for us, as my wife and I, her care involves a daily regime of wrapping her in very specialized bandages all throughout her body, her entire body. So that really means just making sure her open wounds are covered and clean. We have a bathing regime, which is about 3 times a week, and that lasts about anywhere from 1.5 to 3 to 4 hours of what is a painful experience for my daughter, and involves making sure she's clean, her wounds are free from infection, and then she's provided with new bandages as well. These are highly specialized bandages that are non-adhesive, but are very important to keeping our wounds free from infection and protected. Those bandages, either in the private or governmental insurance space, very expensive. They're manufactured from specialized vendors that typical range can cost up to $10,000 or even more a month. We are very fortunate. We have great coverage in our insurance, but if there's ever a gap in that insurance, or there's a lot in our population that have issues getting those bandages covered, even if they are covered, they're characterized as durable, mostly durable medical equipment, and a lot of insurers have yearly caps on those insurance coverage. My professional career now is with a patient advocacy organization named Deborah of America. They're the only organization in the United States that, besides funding research for a cure or treatment, also provides free family services.